All right. Hello, everyone, and Happy New Year to everyone who stays on the channel. Hopefully, 2023 is treating you well. So, as I mentioned before, the channel is getting the covers type of migration. And today we are going to have a chat with Rado. Rado, go ahead. Do you want to introduce the topic and so on, so on?
Yeah, Happy New Year, Nick, and Happy New Year to everyone else who's watching this as well. Um, there's been a lot of commentary in the news about the mRNA vaccines in particular, and maybe not all in the mainstream news, but if you look on private blogs and independent researchers and even there's a number of famous doctors who are coming out there and they talk about the mRNA shots or the experimental mRNA vaccines or whatever term they want to use. Um, and what concerns me about the way people are talking about the mRNA vaccines like that is that it's diminishing all the other harm that we're seeing from the other vaccines. And whilst I don't have exact numbers and I can't say if any of the vaccines are better than the others, we're still going through our own data, but it's even our own data is only a small proportion of everything. But what we can say is that all of the mRNA there you go. I just did that. All of the COVID vaccines that we have, at least here in Australia and in the US, um, they're reporting a lot of these issues. And there are some vaccines that might have a little bit more symptoms, maybe one type of vaccine might have a bit more heart issue, another one might have a little bit more clotting issue or whatever. But generally, all the vaccines are having some serious issues, and we're seeing that in the support groups. And so the message that I wanted to make sure that everybody keeps in mind, and when they're talking about vaccine harm, is they talk about this, is that it's not just the mRNA vaccines, it's all of the vaccines. And my speculation, based on the scientific evidence so far, is it's because they all use the spike protein. And on our website, we have some good scientific articles that we refer to there that supports that perspective. It may not be, it may be something completely different, but that looks most likely, since with all of the vaccines, there's a lot of common adverse events happening to people. This long vax syndrome seems to be common across all of the vaccines, including Novavax and the adenovirus vaccines. So for that, that makes me as somebody who's advocating for the support and research into what's happening to people, we need to keep this broad perspective. And if anybody else out there is, you know, in, is involved with this public discussion, I'd like them to just to keep in mind that we're not just talking about one technology product. Okay, um, even though there are some concerns with, you know, that particular technology. Some questions have been answered, some haven't, many haven't. But it's the problems are occurring irrespective of the technology. So, and I think if we keep that in perspective, it will really help our research efforts. It'll help patient recovery efforts. It'll help recognition and compensation efforts for those patients. And it'll just make everything happen easier and quicker when we recognize the global problem rather than trying to demonize one particular product. What do you think about that, Nick?
Exactly, exactly. Yeah, I completely agree what you mentioned. One thing that maybe not all of the viewers are aware about when you mentioned the data, so maybe we should just talk where do we take this data from, right? So when we are saying that covers has some data, so where does it even come from?
Yeah, that's a good question. We one of the things we wanted to do at Coverst was to collect independent data from people who are experiencing an ongoing issue from their vaccine. And we wanted it to be specific for Australia, because we are an Australian organisation, so that we could have a discussion about the injured people who are in Australia. And so we set up our website for injured people to register, and they have the opportunity to fill out some information about what has happened to them, including their symptoms. But the government drug regulator collects data on symptoms. Um, we wanted to connect that with how serious those symptoms were, how long those symptoms have been persisting for, what the impact has been on people's lives, financial consequences, life consequences. Um, so it's more than just, oh, I hurt. It has impacted my life in a huge way, which the government doesn't collect that data. They just collect symptoms. So we've started to collect this information. I wish we would have started 2 years ago, because there's an awful lot of people who've been very seriously injured who have recovered enough, and they're back at work now, and they've moved on with their lives, and good on them. Um, so we're starting to collect this data. Now, we've got several hundred people just from the Australian data. And so we're starting to see some patterns, so we can see this in the symptom clusters. We can see there's this group of people with cardiovascular symptoms, particularly heart-related type of symptoms. Then another group of people with very neurological type of symptoms, and there's a whole range of other symptoms as well. But for this discussion we're having, Nick, we ask people, what vaccines did they get? Did they have a reaction on their first shot? If so, what brand vaccine? Was it on their second shot? What brand vaccine? Third shot? What brand vaccine? So, you can see as people go along, when AstraZeneca was the first vaccine used here in Australia, and so that's well represented for people who got injured for the first and second shots, but not for third shots, because it hasn't been used for third shots, at least not extensively. But what we are seeing in people who are getting those booster shots is Novavax starting to appear. So that's an interesting pattern. It's not entirely unexpected, given that we already had the idea that it was the antigen, the spike protein, that is is facilitating all of these problems. So so that's where, when I talk about our data, I mean the data that Coverse is collecting. Some of the interesting stuff that we've found is that on average, it's taking people 7 months before they notice any improvement. Now, I was quicker than that. I was at about 3 months, and I think you were about the same, Nick, 2 or 3 months before you improved. Yeah. But some people it's much longer. We know some people who are over 18 months and still not any improvement. So we're tracking that data. The government doesn't track that data. We had this survey app that people could fill out called Ausvax Safety. That's cut off at 6 weeks. So, and then for the drug regulator, they don't follow up any of their reports. They hope that you, as the patient, go to them and offer them more information. But people don't know that. So we encourage people, look, if you're still feeling crook after 6 months, make another report to let them know how you're doing, or update your report. But it's just so disappointing that they don't do that. We have to. And so we've got data that tells the story that the government has not looked into, and thus far has refused to look into. So I think we can tell a far more compelling story about vaccine injury in some respects than what official data can tell. And it's because we care about looking at the individual and what the impact has been and how long it's gone on for, and whereas that type of stuff is just simply not collected by the government. Anyway, so there you go.
It's
That's a long,
crazy. Yeah.
it's a long answer to your question, Nick.
Yeah, no, that's a good answer. It's crazy that it takes creating some third-party organization to do something that it's basically a job of the government, right? It's very frustrating to do
Oh,
all of
very
that.
much so. And we mentioned this in previous video, that it was an absolute shock, probably the biggest shock of my whole experience, at how little the government does with reports. They just collect the reports, and then what? Who's going to help us? Our doctors had no idea what to do with this. They run these tests, it comes back with nothing. So we ask the government, and the government says, it's not our job to look after your health. We just take the
Exactly.
reports. So whose job is it? I mean, are we just supposed to suffer? You know?
Exactly.
So
Exactly.
there's a huge gap in in this entire system. I think part of it comes about because there's this overarching culture, this paradigm, this arrogance that vaccines are very safe, and therefore adverse events are very rare, and therefore these serious incidents are nothing to worry about. Well, maybe that's true, but you and I, we're human beings, don't we deserve to be treated, particularly when we did this because our government said this was the right thing to do for the community. And in many cases, people were mandated to do it. They were basically told, you get the vaccine or you're going to the poorhouse. So, it's absolutely shocking that we have not been looked after better and that the whole systems have been set up to not care.
Exactly. Yeah, this is
So
very scary.
I
It is
hope we
very
can
scary.
change this dynamic, Nick. I really do. And I hope
And
these videos can
rather, one question. Yeah, sorry. Maybe my internet a bit interrupt. I didn't want to interrupt you. So maybe people are interested. So we have this data that we already collected, right? We already see some patterns, etc. Maybe somebody would be interested in anonymized reports that would come public by covers. So, for example, just some numbers, all the data anonymized, just like, let's say, what are patterns we're seeing.
Yeah, absolutely. So when we collect the data, it's private. It's only for our internal collection, but then we aggregate it, and this is in our terms and conditions, is that we can aggregate this data and produce this statistics so that we have a story to tell, a robust story. We are in the process of generating some data that we can present publicly. There's stuff I can tell you now, which if I just bring up our little summary page, I can actually tell you some of the information. But I want to do a little bit more analysis on some of the questions, just so that I make sure that we are telling the right story. So one interesting fact, and this absolutely shocked me, but it shouldn't have, is that of everybody who's filled out this survey, 2/3, when they got injured, 2/3 got another dose. Now that's me. I was injured by my first dose, but it was only, it was mild, and then I got a subsequent dose. Now, in hindsight, somebody should have told me, no, it's not safe for you to have another dose. But of course, the entire government messaging here and all around the world is, no, that's no excuse. You need to get another dose. So 2/3 got a subsequent dose, and of these, almost 80% got worse. So this is starting to tell a story that having an adverse reaction is a massive contraindication for
Yeah,
future shots. So that's one interesting piece that came out. The other interesting piece is around people who were mandated to get the vaccine, and they tried to get insurance cover from their employer. Here in Australia, we call it workers' compensation. Of these people, 60% had issues with their claims. Most of those issues were just outright rejection. So here we are. People are told, go and get the jab, or you lose your job. Oh, you got injured by the jab? Suck eggs. Deal with it yourself. And that's absolutely rotten. And I don't blame the employers, because we're hearing through other channels that some of their employers are so frustrated with this situation because they want to look after their employees. These are really good employees, valuable employees they don't want to lose, and they want to make sure that they look after them really well, but their insurance is not doing the job. And
exactly.
so one of the advocacy things we're in the process of doing right now, and I can't give you details just yet, is to actually try and address this issue with the insurance companies. That will be a process that we go through over the next few weeks, that we may be able to talk about in the future. But we hope that we can make an impact there to help educate these insurance companies about the breadth of the problem and their responsibilities to step up to the plate and support their employer organisations. So anyway, so there you go. That's a couple of tidbits that that have come out.
Awesome.
Yeah.
Awesome, awesome. Yeah, it definitely, this is the best part because again, we're already providing in covers some research that can help other people. So we can already basically see some patterns, and but again, it's so amazing that covers has to do something which the government's supposed to do,
Yeah.
and like millions of the taxpayers' money that are spent on all of the systems, like that are used just to aggregate all of the complaints.
One of my wife's friends overseas had a look at our website. She thinks her husband may be experiencing a vaccine reaction. So my wife just said, "Hey, look, my husband as well," and they've started this organisation here in Australia. And so this lady looked at our website and she was blown away. She said, "Oh my goodness, I wish we had something like this in our country." And she said, "I'm so happy and I'm so sad." She said, "I'm so happy that there's this resource now." And I'll point out that we're not the only one. There's React 19. There's the German organisation. There's the UK organisation. There's a few around the world. But she said, "I'm so sad that it's come down to the injured people to have to do this. It should be our governments, just like you said, Nick. It should be our governments."
Exactly, exactly. Yes.
Yep.
So yeah, Rado, thank you very much. I think for today we've got already a good update for the viewers. Again, for the next one, we can talk about again we can talk about the data. We can invite maybe other members of the covers and etc. Yeah, we'll try to publish at least something once a week so that we'll see some updates. If you don't publish, it means that we are working on something really exciting.
Or we've all had a bad flare up.
Exactly, exactly. Yeah, yeah. Maybe I should have. I didn't have to promise, but
We
but
all like
yes.
seeing your face, Nick. This is your movement that you started on YouTube. So
Well, again, it's time to kind of progress it. I will be definitely. I will try to be as a guest as much as I can. But again, if you don't see me, don't worry. I'm still somewhere behind the scene.
good day.
All
Well,
right.
good day. And I just wanted to re-emphasize the point that if you hear people say mRNA vaccine, blah blah blah, just remember those of us who've been injured, it comes from all of the vaccines, not just those mRNA ones. So we all need help, and they all need research. So that's the
Exactly.
important message to leave. Anyway,
Exactly.
thanks, Nick.
Thank you, Rado. So yeah, see you next time, and let's see what the next topic brings to us. See you. Bye bye.